Hi, my name is Christine Dubois Matson. This is a course project for my Husson University Health, Economics, and Policy course with Dr. Merle Point Johnson. It is a presentation of my policy recommendation summary for Waldo County, Maine. Healthcare costs significantly impact the residents of Waldo County, Maine in several ways, particularly the most vulnerable groups. The lack of accessible social services in our area has profoundly impacted the residents within our community of Waldo County. The lack of available primary care is actually listed as the third most frequently mentioned healthcare indicator. And 29.5% of patients in Waldo County needed to travel more than 30 miles to get to a primary care facility, whereas in the rest of the state, that average is significantly lower at around 20%. And currently, 37% of the population between ages 17 to 46 are uninsured. Additionally, the elderly within our community are facing significant challenges in obtaining the necessary medical care, transportation, and other social support services they need. With 23.3% of our seniors living in Waldo County live alone, the situation can be quickly exasperating, leading to isolation, further deteriorating their current health conditions, and increasing mental health issues. Additionally, if we look at children and young families, we can see that in Waldo County, 18.6% of the children are living in poverty, which means that these young families with children in our community are finding it difficult to access local early childhood education options and nutritional programs. Using recent assessments such as Maine Shared Community Health Needs Assessment is a comprehensive study conducted by public and private hospitals throughout Maine. They have highlighted the crucial issues within Waldo County. These issues include poverty, food insecurity, limited access to health care, and the lack of transportation. For instance, poverty was the most frequently mentioned priority health indicator in Waldo County, which is no surprise that when the pandemic hit, 1 in 10 people in Maine did not have access to reliable sources of food. This research's primary objective is to assess the health outcomes associated with the social determinants, focusing on the disparities in health status, access to health care, and the quality of life among different population groups within Waldo County. Our goal is to develop evidence-based recommendations for policy programs that will address and identify social determinants of health and improve health equity and the community's overall well-being. By using qualitative data provided by Maine Shared Community Health Needs Assessment, this group conducted an in-depth interview with community residents, and this data will be used in the analysis. Yes, the current Affordable Care Act policy has significantly helped the residents of Waldo County, Maine, by increasing access to health care for low-income residents. However, unfortunately, the ACA alone cannot address these issues fast enough, and the people in Waldo County, where access to healthcare providers is limited, are falling through the cracks. The ACA's non-emergency medical transportation NEMT mandates that Medicaid programs provide non emergency medical transportation so that people can get to their medical appointments and treatments. This helps, but is not the answer for everyone. Unfortunately, those with disabilities or chronic conditions may have a difficult time with a 45-minute drive one way. This whole process can wind up taking a few hours, hours that can be exhausting for the patient. This is where the ACU falls short, where more localized community based services could help these patients receive less stressful care. One significant drawback of the Affordable Care Act is the issue of underinsured. While more people have insurance, the coverage may be inadequate, leaving them vulnerable to high healthcare costs and extreme medical debt. The rate of medical debt and bill problems is almost twice as high as the underinsured as it is for those who aren't. I want to emphasize that providing coverage for low-income Americans is the most significant unfinished business of the ACA. The middle-income Americans who do not have employer-sponsored coverage or do not qualify for premium tax credits and cost-sharing assistance face challenges in obtaining affordable coverage. By investing in these initiatives, we will see a significant improvement in the quality of life of our neighbors who reside in these remote locations. This will ensure that all residents have access to essential health services. By providing these essential services, we are tackling these social determinants head on, promoting healthier outcomes, significantly reducing the isolation of many of our community members currently experiencing, fostering a more connected and empathetic community. There is a program by Ohio Healthcare, the Ohio Wellness on Wheels program, that has implemented a mobile social worker and healthcare clinic, and they saw a significant drop by about 50% in their inappropriate emergency room visits as well. Therefore, to address these issues, I'm proposing the following action that have the potential to significantly improve the lives of our community members. If we establish a mobile social worker and healthcare clinic to travel to the remote areas within Waldo County regularly, we could reach those who cannot meet their needs. This mobile clinic would help target community outreach programs that are more specifically needed in different rural areas. These essential services could be tailored to the community's needs. This mobile clinic would lay the groundwork for making a connection with the community members by first, providing them with medical checkups and other basic healthcare services. Second, educating them on telehealth services so they can consult with care even when the mobile clinic is unavailable. Third, help establish and connect those in the community who need mental health support with a mental health specialist. Four, help establish and connect those in the community who have substance abuse issues with substance abuse prevention programs. And five, help connect more tailored social services available to those that need them. Mobile healthcare clinics are known to travel to the heart of the unserved communities, helping to reduce time and cost of patients. These mobile clinics have lower operational costs due to the absence of permanent infrastructure. This means that with a lower overhead, that they can offer services at a reduced fee or even in some cases free of charge. Additionally, by increasing the accessibility to healthcare, this will lead to higher utilization rates, especially for preventative and routine care conditions. And as we know, because it has been proven time and time again, that access increases utilization, resulting in healthier outcomes, which include the reduction rate of chronic diseases and other preventable conditions. There are countless examples of mobile healthcare clinics being introduced into communities with limited access around the country that have already proven to have numerous advantages over traditional healthcare delivery models, which is why I'm positive that by investing in these initiatives, we can greatly improve the quality of life of our community members within Waldo County and ensure that they receive the support they need. Therefore, I hope that you, as our esteemed community leaders, will consider my proposal and vote to increase the funding necessary to address this vital issue. Your support is crucial in making these initiatives a reality. Thank you for listening to my proposal for the Waldo County, Maine community. Here are the references to any statistics mentioned within my proposal. Thanks again. Like and subscribe.